Good morning, good afternoon, good evening to all of my wonderful and juicy and delicious little subscribers out there. And how I love you all so. You're all super duper wonderful, super duper beautiful and super duper delicious, okay? And I hope that you're all super duper well, my delicious little babies, wherever you are in the world, okay? And that life is treating you oh so deliciously. So what do? 3, 2, 1, beam me up, my juicy little lads. Well, there we go. They're nice and bright. Thank you, little lads. You're lovely and bright. Now then, good morning, good afternoon, good evening to any of our lovely passers-by. Okay, much love to you all as well, my delicious babies. And I hope that you too are having a super duper delicious time wherever you are in the world. Now then, my video today, my delicious little babies, well, it seemed to be looking a little bit misty. Okay, so I'm not too sure what all that is about, my delicious little babies, okay? So just to let you know what our weather's like in our old neck of the woods in the old UK, where I am anyway. It could be different in other parts of the UK. Well, the sun is shining, so what do we sing? The sun has got his hat on, hip 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 hooray. The wind has picked up, so it may look all delicious and warm out there, my delicious little babies, okay? But it is rather chilly, okay? Now then, and of course, all last night, it's been super duper windy, so there's been branches, breaking off trees and everything else, okay, my delicious little babies? So that's the weather update for today in my neck of the woods in the old UK. Now then, if you do happen to enjoy my video, my delicious and wonderful little babies out there, if you could please click on the like for others of you. Please feel free to subscribe if you happen to stumble across my channel and you do enjoy my videos, okay? Also, if you'd like to share my videos with others, with some of the information that I give out, okay, because I do like to give information out. And finally, if you'd like to leave a comment, it's always welcomed. And please and thank you. Now then, so I've got one piece of information today, and then I'm going to have a little natter about other things, actually. So if you could please go on to my delicious little babies, yes, it's on YouTube. Okay, because I'm not going to shut up about this. No, I am not. And if you could please type into the space bar virus, and thank you, virus tsunami. Okay, so virus tsunami puts Shanghai, okay, into silence, and medical experts tell the truth, okay? So I should just repeat that just once more, my delicious little babies, yes? Very important to take a look at this, my delicious little babies, yes? Please and thank you. Virus tsunami puts Shanghai into silence and medical experts tell the truth. Now, in the subscribe box, it should say China Insights, okay, my delicious little babies, yes? And it's on YouTube, okay? So please take a look, okay? Because as we very well know, with our putrid governments in the old UK, in our neck of the woods, and elsewhere in the world, okay? Well, as we very well know, it seems to be rather shushy. Do you see what I'm saying to you, my delicious little babies, yes? But you will see the truth of it. And you will see the truth that, the medical staff and everything, well, they cannot cope with that volume. Do you see what I'm saying to you? Now, some would say, crisis actors. No, I really do not feel that this is the case at all, my delicious little babies, yes? This is flipping real. Okay, my delicious little babies, yes? Now then, so that's my piece of information today. So if you could please take a look, my delicious, beautiful little babies, yes? Now, I did a video, a while back, actually. And, I was talking about the, this cervical screening. Well, my delicious little babies, just to let you know, okay, I have received, in fact, I forgot to turn my address. I do apologise, my delicious little babies, yes? So what's happened now then, my delicious little babies? Because I want to talk about this. Yes, I do. So what have I received now? Another one. Okay, my delicious little babies. Yes, so here we go. So I'm going to read it out to you. Now, really, there is talk of, you know, different things on the internet, so I do not believe that I'm saying anything wrong, my delicious little babies, yes? Okay, because I do not feel that I am. If it's flipping public knowledge out there, do you see what I'm saying to you, yes? So, dear Mia, yes? A few months ago, we invited you for a cervical screening, previously called, this is in brackets, my delicious babies, previously called the smear test, okay? Now then, so see how they're changing things, my delicious little babies, yes? Our records show, their records show you have not yet attended. Oh. If you have had screening in recent weeks, please ignore this letter. So please just remember, my delicious little babies, that this is now the second letter. There we go, ding ding, okay, that I've received, okay? You can still book an appointment for screening. To do this, please contact your GP practice. Are these the same friendly quacks that half the population in our neck of the woods in the old UK cannot even get an appointment? Is that what they're talking about? Anyway, let's proceed. In some areas, local, you know, health clinics may also offer screening. The test only takes a few minutes and you can ask for a female nurse or doctor. Okay, so like I said before, and I'm saying it again, it does not take a few minutes, my delicious little babies, okay? If you would like to talk to someone about cervical screening, please contact your GP or practice nurse, okay? So we invite women 25 to 64 and registered with a GP. You should consider having cervical screening regardless of your orientation or history, yes? Or whether you have had the human papilloma virus, HPV in brackets, vaccination. See? My delicious little babies. Now, I do not need to read anything more, okay, of this, so here we go. So why are they so desperate, my delicious little babies? This is what I want to know now, yes? Here we go, look, yeah? Okay, that's what I say to that. So why are they so desperate to get myself as a woman, okay, and other women to go and have a smear test? Are you all following me? Ding, ding, my little babies out there, yes? Second letter. It's a bit like the old COVID. Do you see what I mean? Where I received 3. Started off as small writing, then went larger, and then even larger. You know, sort of treating you as if you could not read. Do you see what I'm saying? I mean, God bless the dear souls who cannot read, so I didn't mean it that way, okay? But are you following what I'm saying, yes? Now, as we very well know, and what we've all been experiencing and hearing about, because it is, which it is, it's common knowledge, yes? That, you know, our NHS and other things and, you know, doctors' surgeries and everything are in a right flipping mess at the moment. Do you see what I'm saying to you, my delicious little babies? Yes, but they're so desperate, aren't they? To get these poor dear women out there and ladies to get their screening done so we know what's going on here. Ding, ding. Do we not? Yes, we do. So I'm going to keep going on about it in any way. Like I said, there's, you know, other platforms where they talk about other things. Do you see what I'm saying to you, my delicious little babies? Yes, but I just like to keep highlighting these things, okay? Please and thank you. I'm actually, there we go, before I even say it, I'm trying to help. Anyway, so there's another piece of information here I received through, you know, through my letterbox, yes? Now this here, look at this now. NHS prescriptions delivered to your door, pain-free. Pain-free, everybody. Okay, so let's just read what it says on the back, shall we? Yes? Right. Just need a sip of my coffee, please, and thank you. Now then, your postie. Oh, postie. So they're not called a postman anymore, my delicious little babies, or a post woman, or ladies and gentlemen, yes? They're called posties now. Okay? So your postie can now deliver your NHS prescription. Okay? Then it says, how good is that? Okay? And a question mark. So let's have a look. Let's be frank. Going out to pick up your prescription can be a bit of a pain. Oh. So for those of us, delicious little babies out there, and God bless anybody who does not have legs. I do not mean it that way, my delicious little babies. Okay, no, yes. But for most, well, they would want to travel out, wouldn't they? Or go for a walk. Ding, ding. Are you following me, my delicious little babies? Sorry, yes? So let's proceed. The good news is that you no longer have to, so they want you to be confined to your home. Okay, let's have a look. Because Royal Mail Health now, okay, have teamed up with, what's it called? Pharmacy to you. So it's pharmacy and a number 2 and a U for umbrella. Okay, so they're obviously not spelling things the same either, are they, my delicious little babies? Yes, okay, we see a lot of that, don't we? You know, like on messages, you know, like on anything, could be WhatsApp, could be anything. Or if you're texting somebody, yes. Well, you know, what seems to have been happening for rather a long time, my delicious little babies, yes? It's like, I don't know, let me just think of the most common thing going, I love you. So instead of doing a I love you, which would be LOVE, I'm going somewhere with this, my delicious little babies, yes? I'm just trying to get everyone to be aware for those delicious and wonderful little babies who are not aware, okay? Then they put I heart you for umbrella. Well, really, if you're going to say I love you, wouldn't it be better to spell it as I, the letter I, LOVE, yes, and then YOU? Well, that's how I was brought up anyway. There we go. Ding, ding. Do you see what I'm saying to you? Yes? Okay, so seems very much to me language, there we go, ding, ding, seems to be changing, doesn't it? And it has been for rather a long time now. But when they're easing you into things, you see, not everybody, I'm not saying everybody, my delicious little babies, but for some, they're not paying attention to these things, and that's not being disrespectful here. So let's proceed in reading. The UK's largest online pharmacy. Yes, really want to get it out there. There we go, ding, ding, don't they? All cold here. Yes, to deliver your prescription directly through your letterbox. Look at that. Reliably, sorry. Okay, so I'm trying not to use my specs. And safety, okay? Now then, delivery is free, okay? So all you need to do is register online. See, here we go again. You see what I'm saying to you, my delicious little babies? Yes, that's what they're doing, pushing everything. I know what I'm talking about, but yes, I do, ding, ding, yes. So, right. And we'll take care of the rest. Yes. Because they're so caring, aren't they? We'll even send you handy, listen to this, my delicious little babies, yes? Handy reminders so that you never run out. Yes, because we cannot have that, can we, my delicious little babies? No, 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 we can never run out, okay? It's as easy as that. Okay, so simply download our Royal Mail Health app. See, app again, app. My delicious little babies, yes, okay. The bank, when I went in to go and get a replacement card the other day and my emergency cash, because obviously the wording is changing, yes, they wanted to see whether I wanted the bank app. I said no thank you. Okay, so here we go. Or visit us online at royalmail.com/health/pharmacy to you. Okay, so what do we say about that? There we go. Okay, so that's another one. Okay, so that was a waste of time sending me that as well. Now then, so there's another one here. I've forgotten to flipping right to tear it off. Sorry, my delicious little babies, yes. So, right, okay, let's have a look. This is NHS again, everybody, my delicious little babies. Now I'm going to read out to you, okay, my delicious little babies, yes? Right, dear Mia, okay, so this is something else now. Join thousands of people who have already accepted an invitation to take part in what will be the UK's largest ever health research programme. Just, excuse me, my delicious little babies, just let me pause for a moment while I just have a sip of my coffee, please, and thank you. Interesting. Do you not think, my delicious little babies? Because I do. Okay, let's look a bit deeper, shall we? You are invited to take part in a new health research programme called, wait for it everybody, Our Future Health. Our Future Health! Okay? Does culling come to mind, my delicious little babies? Okay, so let's proceed in reading. This letter explains what is involved and what to do next. Oh. Today, too many people spend many years of their life in poor health. Well, Ugga, why are a lot of delicious little babies, God bless the beautiful dear souls, in poor health? Because for many flipping decades we've been blooming poisoned. That's the reason why, my delicious little babies, okay? And I'm not shouting at you, my delicious little babies, it's just I'm very passionate about some subjects that I discussed. There we are, ding ding. Okay, so let's just proceed in reading, okay? Our Future Health aims to help researchers, okay, prevent, detect and treat diseases earlier. Oh. So we all know what's been going on, don't we, my delicious little babies? You know. Do you know what I mean? And maybe if somebody didn't have something, well, God bless them. For a lot, they've flipping got it now, haven't they? Are you following me, my delicious little babies? Yes? So let's proceed. Diseases, here we go, like dementia, cancer, diabetes, heart disease and stroke. Our Future Health will be the UK's largest ever health research programme. With up to 5 million volunteers. Look at that. Volunteering. People over the age of 18 in the UK are eligible to take part. Taking part involves, number one, answering some online questions about yourself. Are you following me, my delicious little babies? What I'm saying to you, yes? Online. Do you see? Right, please and thank you. Number 2, giving our future health permission. Listen to this now, my delicious little babies. Please wait for this now. Giving our future health permission to securely link to your health records. Have you heard this, my delicious little babies? Yes? I was saying on a video some months ago. It may still be there, then again it may not. Okay. Are you seeing where we're going with this, my delicious little babies? Anyway, they're going to be getting a flipping telephone call from me tomorrow morning. Yes, they flipping well are. Okay. Now then, number 3. So I cannot tear this bit up, my delicious little babies, because I'm going to be speaking to these. Okay. So number 3, listen to this. Just gets better, doesn't it? Providing, okay, a blood sample, okay, blood again, and having some physical measurements taken at one of our local clinics. Oh, physical measurements as well. Since when do I need to give any flipping blood sample or, okay, have physical measurements? Whoever it is a flipping joker who put this together. Or jokers, shall we say. Now then, you will also be offered information about your own health. Oh! So I need information from some flipping Egypts and twats to tell me about my own health now. Right, okay. Where am I? Right, okay, including, sorry about that, my delicious little babies, including your blood pressure and cholesterol levels. Well, I did a video a while back, my delicious little babies, yes, that the cholesterol is just a crock of shite. Okay, when you look into it. Do you see what I'm saying to you, my delicious little babies? Yes, it's just another way to get to pop a pill. Do you see what I mean? Not to eat things and certain things, yes? Right. Your data will be stored and managed securely and to the highest professional standards. Oh, so when we look over the years, how many professionals are there? Because I haven't flipping really seen any. Have you, my delicious little babies? In compliance with data protection laws. So here we go again, laws again, which let's just sort of point this out here, that a lot of the laws that we have are flipping illegal anyway. Right, if you have any questions, please call 0808 and what it is, yes, or email support at ourfuturehealth.org, yes. So we've got, and look at this now then. So we've got 2 doctors here. Oh, look at this. Very interesting. Dr. Raghib Ali, OBE, my delicious little babies. Does that remind you of something, my delicious little babies? Ding, ding. Okay. Chief Medical Officer, right. And Joint Chief Investigator. Oh, look at this, and where's he from here? Our Future Health NHS Consultants in Acute Medicine. Oh, where's that? Oxford. Oh, you know Oxford that's going to be having this 15 minutes, but we are having more standing up there against this shite. Do you see what I'm saying to you, my delicious little babies? Yes, because like I said, it's not just in Oxford, it's going to other places and other places in the world as well, my delicious little babies, yes? And the other doctor is Dr. Andrew Rodham. What's that? D. Phil, Joint Chief Investigator, Our Future Health. Right. Well, I should be speaking to these tomorrow, my delicious little babies, just to let you all know that. So, unfortunately, that cannot be torn up until tomorrow. Now, finally, when I was first receiving the, these letters, yes, when I was first receiving them, the old jabs, yes, jibby jabs, yes. Well, in the letter, in the first one, this is in the first one, okay? I'm just going to have another sip of my coffee, please, and thank you, my delicious little babies. Now, hopefully, just to let you know this as well, my delicious little babies, and thank you so ever much for even anybody who happens to watch my video today, okay? My delicious little babies, I'm only pointing things out and I'm trying to help, okay? My delicious little babies, that's all I ever try to do, okay? There we go, I'm all cold here, yes? So, even if you do happen to watch me, so please and thank you, and even if you click on the like, thank you, I feel very humbled, okay, and thankful, yes. Well, let me just get back to this now. So this was the first, okay, that I received in a letter at the start of the old pandemic. This, okay, my delicious little babies, yes, and I want to read it out. Somebody said, keep it, keep it. So that's what I did, yeah, got plenty to say here. So let's go through this, shall we? Yes, my delicious little babies. I know that for some things this video is not going to be for everybody, okay, my delicious little babies, but like I said, I like to get my videos out. I try my utmost to do a video every day, okay, my delicious little babies. This is what I try my best to do, okay, my delicious little babies. So let's just have a look now. We'll get through this as quickly as possible, okay? Sorry. COVID-19 vaccination, a guide for adults. So you have to be guided, yes. This leaflet explains about the COVID-19 vaccination, yes, who is eligible and who needs to have the vaccine to protect them from coronavirus. So correct me if I'm wrong, but if you look in an encyclopedia, and you look at coronavirus, it equals a common cold, doesn't it? Anyway. So then we go on to the next part. What is COVID-19 or coronavirus? And a big question mark. COVID-19, excuse me, is caused by a new coronavirus known as SARS-CoV-2. See, always numbers, isn't it, my delicious little babies? Yes? Okay. So it was first identified in late 2019. It is very infectious, so infectious, okay, and can lead to severe respiratory, disease, okay. Many people who are infected may not have any symptoms or only have mild symptoms, okay? These commonly start with cough, fever, headache and loss of taste or smell, okay? Some people will feel very tired, having aching muscles, diarrhea and vomiting, fever and confusion. A small number of people then go on to have severe disease, which may require hospitalisation or admission to intensive care. Yes, we was hearing about a lot of this, wasn't we? Past few years. Overall fever, now this is in a box by the way, just here, my delicious little babies, yes. Overall fever, then 1 in 100 people who are infected will die from COVID-19. But in those over 75 years of age, this rises to 1 in 10. Just want you to just ding ding, cast your mind back, my delicious little babies, okay? Please and thank you. There is no cure for COVID-19, although some newly tested treatments do help to reduce the risk of complications, okay? Is everybody following, my delicious little beautiful babies out there, yes? About the types of vaccines, we get onto this part now. Okay, so hopefully my video will stay up, my delicious little babies, because others are talking about it. So why must my video be taken down? Do you see what I'm saying to you, my delicious little babies? Yes? Because if that's the case, it's very flipping most unfair. Anyway, I'll just proceed. In the UK, several different types of COVID-19 vaccines will be used during 2021. The vaccines will only be approved on the basis of large studies of safety and effectiveness. Now, correct me if I'm wrong, my delicious little babies, but over the months I've been doing videos which is telling quite a different story. Are you following me, my delicious little babies? Yes. And I've also advised, you know, or made suggestions just to look at other videos like UK column and different things like that, because they're so wonderful. I love them. Do you see what I mean? I love everybody who I'm subscribed to. Do you see what I mean? Anyway. So yes, very important that, isn't it? Will only be approved on the basis of large studies of safety and effectiveness. Please keep this in your little noddles, my delicious little babies. And that wasn't meant as an insult, by the way. It's just the way I rock and roll, the way I talk. Okay. Who should have the COVID-19 vaccines? And there's a question mark there. Yes. The Joint Committee on Vaccination and Immunisation, in brackets, JVCI, it looks like, an independent expert group. So who is this? What we want to know is, who is this independent expert group? I cannot stand that word, my delicious little babies, because nobody is an expert, okay? We're always learning, so no, that word should not even be in the dictionary. Anyway, let me proceed. Has recommended that the NHS offers these vaccines first to those at highest risk of catching the infection and of suffering serious complications if they catch the infection. This includes older adults. So we get back to this again, don't we? Do not seem to really like our beautiful dear elderly, do they? No. Okay, frontline health and social care workers are the ones who are supposed to be helping when others are poorly. Okay, so please keep all this in your noddle, my delicious little babies, and thank you. Okay. Care home residents and staff. See, we get back to that again, don't we? Ding ding. Do you see? And those with certain clinical conditions. When more vaccine becomes available, the vaccines will be offered to other people at risk as soon as possible. Yes, because they have to do it as soon as possible, don't they? What can I do after I have had the COVID-19 vaccine? And there's another question mark. See, lots of question marks as well, isn't there? Yes. Lots of things need to be questioned anyway. The vaccine cannot give you COVID-19 infection. Oh! It cannot, everybody. And 2 doses will reduce your chance of becoming seriously ill. Didn't, so correct me if I'm wrong, but didn't That Boris Twat Johnson, didn't he say, because I've seen it on YouTube somewhere, yes? Didn't he say that after one would have had the 2, yes, that it still doesn't protect you? Didn't he say that a while back, my delicious little babies, yes? Or, you know, have I got this wrong here? Because I do not believe I have. So let's proceed. We do not yet know how much it will reduce the chance of you catching and passing on the virus. Okay? Did you all get that, my delicious little babies? Yes? So, it is important to continue to protect those around you. Well, surely to goodness, hello, ugga, this is common sense. Well, really, shouldn't you be protecting yourself? No matter who we are, not meaning that disrespectfully with my delicious little babies, in your everyday. Do you see what I'm saying to you, yes? Okay. So, remember to protect yourself and your family. Yes, friends and colleagues. You, and then, see, capital letters here. You must still follow any national or local restrictions. You must. Do you see what I'm saying to you? Yes, that's telling, isn't it? Yes, it's not asking you, it's telling you. Do you see what I'm saying to you, my delicious little babies? Yes? So, number 1, practice social distancing. Okay. Number 2, wear a face mask, you know, one of them muscles, okay, so you cannot see your boat race, cannot see anything. Do you see? Yeah. And 3, wash your hands regularly. Yes? Okay. So, correct me if I'm wrong, you know, it's like if you're going to cook, say for example, yes, my delicious little babies, or if you're having a bath or a shower or washing your hands after you've been to the toilet, yes. Well, do we not have our old noddle, ugga, to know to switch your tap on, hand wash and wash your flipping donnies, your hands? So correct me if I'm wrong, and they're not treating us like a load of flipping twats and twits out here. That's all I'm asking. Anyway, so let's just proceed. I'm not shouting at you, my delicious little babies. It's just I get flipping wound up. You all know I do anyway, my delicious little babies. Am I at increased risk from COVID-19 infection? And again, another question mark. Coronavirus can affect anyone. If you are an older adult, so we get back to that again, my delicious little babies, and have a long-term health condition, yes, seem to be really targeting. Do you see what I'm saying, my delicious little babies? COVID-19 can be very serious and in some cases fatal. Okay, so that's what that's telling you. Okay, excuse me, sorry. You should have the COVID-19 vaccine if you are. Look, we've got a nice long list here. So we're just going to go through this list, my delicious little babies. So, an adult living or working in a care home for the elderly. So caring, aren't they? Number 2, so that was number 1, a frontline healthcare worker. Number 3, a frontline social care worker. Number 4, a carer working in, you know, Dom Millicent, care, okay? The next one is the sole or main carer for a highly vulnerable individual aged 65 years and over. Next one, younger adults with long-term clinical conditions, in brackets, see below. The vaccine will also be offered to adults with conditions such as, here we go, another long list. A blood cancer, in brackets, such as leukemia, lymphoma, or what's that? Myelomal, okay? Then diabetes, dementia, a heart problem, a chest complaint or breathing difficulties, including bronchitis, emphysema or severe asthma, a kidney disease, a liver disease. Lowered immunity due to treatment for cancer, in brackets including chemotherapy and radiotherapy. Lowered immunity from the treatment of conditions such as rheumatoid arthritis, lupus and psoriasis. Disorders of the immune system, in brackets including HIV infection. Having had an organ transplant, okay? Having had a stroke or a transient, what's that? Ischemic attack, TIA in brackets. A neurological or muscle wasting condition, you know, like peripheral neuropathy, yes? A severe or profound learning disability. A problem with your spleen, e.g. sickle cell disease, or having had your spleen removed. Are seriously overweight, what's that in brackets? BM, okay, a BMI of 40 and above. Are severely mentally ill. Oh, it's a rather long list, isn't it, my delicious little babies? Yes. So all people who are in the clinically extremely vulnerable group will be eligible for a COVID-19 vaccine. When you are offered the vaccine may depend on the severity of your condition. Your GP, your friendly quack, can advise on whether you are eligible. Now then, we're nearly at the end now, my delicious babies, yes? A lot to read there, okay? So I apologise if the video's gone on a bit too long, my delicious little babies, but to me this is very flipping important indeed. Who cannot have the vaccine? And a question mark again. The vaccines do not contain organisms, okay, that grow in the body. Been hearing other things though, haven't we, my delicious little babies? Yes, okay. And so are safe for people with disorders of the immune system. These people may not respond so well to the vaccine. A very small number of people who are at risk of COVID-19 cannot have the vaccine. This includes some people who have severe allergies. Who should wait to have the vaccine? Question mark. If you are currently unwell, self-isolating or waiting for a COVID-19 test, you should delay vaccination until later. Here we go. Something else, my delicious little babies, yes? Pregnant women may prefer to wait to have the vaccine until they have completed their pregnancy. Read the detailed information on www.nhs.uk/COVID vaccination. Okay, my delicious little babies, and that's not offensive to any dear lady out there who's struggling to conceive or is having problems or issues, okay? So I did not mean it that way, I was just reading out, okay, my delicious little babies, okay? Will the vaccine protect me? The COVID-19 vaccine will reduce the chance of you suffering from COVID-19 disease. It may take a few weeks for your body to build up some protection from the vaccine. Did you hear the words in there, my delicious little babies? Yes? Right. Like all medicines, no vaccine is completely effective. Do you see what I'm getting at, my delicious little babies? Yes? So they're pushing it on all the other pages, yes? And then towards the end, like all medicines, no vaccine is completely effective. Well, they're done telling you, aren't they? Do you see what I'm saying, my delicious little babies? Some people may still get COVID-19 despite having a vaccination, but this should be less severe. Can you see what I'm saying? So they're done telling. Will the vaccine have side effects? Okay, so like all medicines, vaccines can cause side effects. Most of these are mild and short term. Please keep that in your little noddles, my delicious little babies. Yes, please and thank you. And not everyone gets them. Even if you do have symptoms after the first dose, you still need to have the second dose. Right, okay. So something doesn't agree with your body, okay? Let's just get this, in our old noddles, yes? So it doesn't agree with your body, why go back and have a second one? That's all I'm asking. Okay, because that's what that says, isn't it? Yes? So it's saying even if you do have symptoms after the first dose, yes, right, you still need to have the second dose. Do you see what I'm saying to you, my delicious little babies? Yes? Anyway, I know what I'm saying. Although you should get good protection from the first dose. Well, if you get good protection, why do you need the second dose? That's all I'm asking, my delicious little babies, yes? Having the second dose should give you longer lasting protection against the virus. Very common side effects include having a painful, heavy feeling and tenderness in the arm. Well, why would that happen? Where you had your injection. This tends to be worst around 1 to 2 days after the vaccine. Then it's feeling tired, headache, general aches or mild flu-like symptoms. Well, if something's protecting you, you wouldn't be getting all this, would you? So, all I'm saying. Right, you can rest and take the normal dose, okay, of paracetamol. Follow the advice in the packaging to help you feel better, although feeling feverish, well, according to what I'd looked at, the paracetamol didn't really work very well anyway, right? To help you feel better, although feeling feverish is not uncommon for 2 to 3 days. A high temperature is unusual and may indicate you have COVID-19 or another infection. Now are you seeing what I'm saying, my delicious little babies? Yes? You can... Oh, sorry, do forgive me, I'm on the next one. Right, symptoms following vaccination normally last less than a week. If your symptoms seem to get worse or if you are concerned, call NHS 111. Okay, my delicious little babies? If you do seek advice from a doctor or nurse, please make sure you tell them about the vaccination, in brackets, show them the vaccination card if possible, so that they can assess you properly. You can also report suspected side effects to vaccines and medicines through the yellow card scheme. See next page. Now, for lots of those wonderful and delicious little babies out there, the yellow card scheme, okay, which it's very clear to me that when the putrid letters were going out, my delicious little babies, yes, that not everybody was looking. And I'm so sorry to have to say that, but they were not. Okay, my delicious little babies, yes? Right. If you are currently in the clinically extremely vulnerable group, please continue to follow the government guidance. Yes, so they were telling you. Okay, plain sight. You cannot catch COVID-19 from the vaccine, but it is possible to have caught COVID-19 and not realise you have the symptoms until after your vaccination appointment. The most important symptoms of COVID-19 are recent onset of any of the following: a new continuous cough, a high temperature, a loss of or change in your normal sense of taste or smell. If you have symptoms above, stay at home and arrange to have a test. Okay? What do I do next? Phew. Do you know, it's been tiring just reading this, my delicious little babies, yes? Seems to be an awful lot of numbers and an awful lot of flipping writing. After you have had the first dose, you need to plan to attend your second appointment, or you need to plan, okay? You should have a record card, and your next appointment should be between 3 and 12 weeks later. Although the first dose will give you good protection. Okay. You need the second dose to get longer lasting protection. What should I do if I am not well? When it is my next appointment, you know, with these, which are supposed to protect you and anyway. If you are unwell, it is better to wait until you have recovered to have your vaccine. But you should try to have it as soon as possible. It's just words, isn't it, really? They just want to get you in there and bang it in. Do you see what I'm saying to my delicious little babies? Yes? You should not attend a vaccine appointment if you are self-isolating. Do you see what they do with the words, my delicious little babies? Yes? It's so important what I'm saying today on our video. Okay, my delicious little babies, please and thank you. Waiting for a COVID-19 test or unsure if you are fit and well. See, they put it again there. Please read the product information leaflet for more details on your vaccine, including possible side effects, by searching coronavirus yellow card. So it's twice. My delicious little babies, I read this out to others, you know, when I first received this, you know, my delicious little babies. Yes, I flipping did. And for most, God bless them, still went out and did it, even after. Anyway, you can also report suspected side effects on the same website or by downloading the Yellow Card app. Finally, remember, COVID-19 is spread through droplets expelled from the nose or mouth, particularly when speaking or coughing. So the old masks and muzzles, do you see what I mean? So that nobody speaks to each other. Do you see what I'm saying? There we go, ding ding. Do you see what I'm saying, my delicious little babies? Anyway, I've been cold throughout this. It can also be picked up by touching your eyes, nose and mouth after contact with contaminated objects and surfaces, okay? You must still continue to follow any national or local restrictions. Practice social distancing. Wear a face mask, you know, the old muzzle. Wash your hands regularly, yes? Vaccine helping to protect those most vulnerable. Well, my delicious little babies, I feel like I've said enough now, okay? I'm awfully sorry that the video has gone on so long, but I wanted, because this needs to be remembered. Because as more and more delicious little babies out there actually wake up, God bless the beautiful dear souls, and many are, there is going to be big flipping, there we are, trouble. Do you see what I'm saying to you? Yes? Okay, and I also seen somewhere else just before you go, just before I go, sorry, my delicious little babies, that in China, Of course, I haven't heard the video, I only just looked at the, okay? So whether this is true or not, I would have to listen, okay? Then, you know, sort of check it with something else, okay? So I'm not entirely sure yet, so I'm just being honest, my delicious babies. But you got some of the rich and the elites, haven't you, moving out of China? It seems. Do you see what I'm saying to you, my delicious little babies? I wonder why that is, if it is true. Wonder why that is. Just like the, was it the Sri Lankan president not so long ago when he fled as well? You see? Because you see, this is what's happening. Do you see what I'm saying to you, my delicious little babies? Yes? And of course, everything is shushy, shushy, isn't it? And if you say something, well, you're not allowed to say something. Do you see what I'm saying to you? Yes? But they're not going to be able to, what they've been trying to do, and even by censoring and everything, to cover this up. Because we all know, for those of us delicious and wonderful little babies out there who do know, we know exactly what this flipping is. Not to mention in years to come, what it's going to be like. Anyway, this is all I've got to say. So yes, I have had a moan. Do you know what I'm saying to you, my delicious little babies? Yes. But I'll tell you something, none of us should ever forget what's being done in our neck of the woods in the old UK and all over the world. No, we should not. This is flipping very serious indeed. Yes, it is, my delicious little babies, and I'm not shouting at you. It's just I get really... Anyway, that's my video, my delicious little babies. So thank you once again for even taking the time to even, you know, listen to my video. It's just that it really hurts me to know what has been going on. Yes, it does, my delicious little babies. So please, never forget, because let me tell you, these are not going to get away with it. No, they are not. Do you know what I mean? So they might be flipping, you know, smiling at the moment. We'll just see, won't we? Okay, my delicious little babies, yes. Please do not forget that digital ID either. You've got up until the 31st of March. Funky Prepper, okay? If you pop onto his platform, God bless him. And God bless you all, my delicious little babies. I'm just trying to help at the end of the day, okay? But we haven't got long, okay, my delicious little babies, so it's just to let you know, okay? And that's all I want to say, really. So until my next video, please continue throughout this bonkersness to feel alert, okay? Please help whoever you can as well, you know, because God bless, you know, there's going to be some who are just, you know, not in a good place. God bless the beautiful dear souls, okay? So please try and help them, please, and thank you, okay? Now then, until my next video, so much love to you all. God bless. Have a beautiful morning, afternoon or evening, wherever you are in the world, okay? You just all look after yourselves now, my delicious little babies, yes? Because we will get through it. It's just we have to sit in the eye of the hurricane. And of course, during this time, you know, there's lots of different things going on. Anyway, so that's the video, my delicious little babies, yes? So until my next video, so much love. God bless. Take care. Thank you for listening. To those of you, much love. Thank you. Bye-bye.